I'm Joe Graedon.
And I'm Terry Graedon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Last year, Americans spent more than $40 billion on over-the-counter medications. How safe are these drugs? This is the People's Pharmacy with Terry and Joe Graedon.
Many of our most popular OTC medicines were once available only by prescription. Do brands like Motrin and Nexium lose their side effects when they become available without a prescription?
Some brands like Bayer Aspirin and Pepto-Bismol are household names. Could this familiarity be dangerous?
People rarely read instructions on OTC packaging. How could this get them into trouble?
Coming up on the People's Pharmacy, the hazards of overdosing on OTC medications.
In the People's Pharmacy Health Headlines, a meta-analysis in the Annals of Internal Medicine reports that low testosterone levels are associated with a shorter lifespan. The investigators reviewed 11 studies involving more than 24,000 men. When testosterone levels dropped below 213, there was a higher rate of all-cause mortality. If levels fell below 153, there was also an increased risk of cardiovascular death. When androgen levels fall, men often experience loss of muscle, fatigue, and depression. It's not clear from this research whether testosterone supplementation would be helpful or harmful.
The Mediterranean diet is renowned for its benefits on heart health. Now, Spanish researchers have studied the benefits for weight loss and gut microbiota. They recruited 400 volunteers between 55 and 75 years old who had participated in the original PREDIMED trial. The participants were evenly divided between a group that followed an unrestricted Mediterranean-style diet and a group that followed a low-calorie Mediterranean diet and exercised. The researchers collected blood and stool for analysis at the start of the study and after a year of intervention.
In the course of the year, the volunteers in the intervention group did lose weight. Their blood tests also showed improvement in blood sugar and lipids like cholesterol. In addition, there were shifts in the distribution of gut microbes identified in the stool. Overall, the diversity of microbes increased, but there were decreases in certain microbes, specifically Eubacterium hallei. According to the investigators, this species ferments lactate and is especially common among people with insulin resistance. Presumably, decreasing levels are associated with better insulin sensitivity and blood glucose control. The scientists point out that both diets are helpful, but the intense intervention resulted in better gut health as well as weight loss.
A recent analysis shows that people consuming at least a half tablespoon of olive oil daily are 28% less likely to die of dementia. The researchers made use of extensive data collected through the Nurses' Health Study and the Health Professionals Follow-Up Study over nearly 3 decades. Previous analysis of these data showed that people consuming half a tablespoon or more of olive oil a day lower their chance of cardiovascular complications. During the course of the study, 4,751 of the 92,383 volunteers died of dementia. All of the participants answered detailed dietary questionnaires every 4 years throughout the study. The investigators also assessed how closely these initially healthy American adults adhered to a Mediterranean type of diet. According to the analyses, people consuming the most olive oil were less likely to die of dementia, regardless of whether they followed a Mediterranean eating pattern. In addition, each additional 5-gram increment of daily olive oil consumption offered extra protection against dementia-related death. Using olive oil instead of margarine or mayonnaise also appeared to provide protection.
A new study adds to the evidence that a diet heavy in omega-6 fats from corn, soy, sunflower, safflower, or sesame seeds can be dangerous. Omega-3 fats, on the other hand, come from fish and from certain seeds such as chia, walnuts, or flax seeds. The ratio between omega-3 fats and omega-6 fats seems to be quite important. The researchers had data from more than 85,000 middle-aged adults participating in the UK Biobank study. Dietary information and blood samples were collected between 2007 and 2010. The scientists then followed the volunteers for an average of 13 years. During that time, more than 6,000 of the participants died. Higher ratios of omega-6 fats to omega-3 fats were linked to a 26% increased chance of premature death. High ratios of omega-6 to omega-3 fats were also associated with a higher likelihood of cancer or cardiovascular death. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graedon. I'm a medical anthropologist.
And I'm Joe Graedon. I'm a pharmacologist. Today, we'll be discussing the hidden hazards of OTC medications. We invite you to join the conversation at 888-472-3366. You can email us your questions about non-prescription drugs, radio@peoplespharmacy.com.
Here in the studio, we have Dr. Stephanie Ferrari. She holds the impressive title of the Henry L. Smith and James L. Olson Distinguished Professor in Pharmacy Practice, and she's chair of the Division of Practice Advancement and Clinical Education at the UNC Eshelman School of Pharmacy. Welcome, Dr. Ferrari.
Wonderful to be here.
Before Dr. Ferrari begins answering your questions about over-the-counter medications, we'll hear from Dr. Lisa Sanders about a medical mystery. Dr. Sanders is the medical director of Yale's Long COVID Multidisciplinary Care Center. She's been writing the diagnosis column for the New York Times Magazine for more than 20 years. Her books include Every Patient Tells a Story, Medical Mysteries and the Art of Diagnosis, as well as the book Diagnosis, Solving the Most Baffling Medical Mysteries. She has an intriguing mystery to share.
Welcome back to the People's Pharmacy, Dr. Lisa Sanders.
Thank you so much for having me back. It's always great to be here. Y'all do such great stuff.
Oh, thank you, Dr. Sanders. We want to talk about a story you wrote recently about Pepto-Bismol. I mean, it's such a bizarre story because, we kind of take it for granted. Hey, it's over the counter, no problem. You described a 70-year-old man. He was in great health, walking 10 to 15 miles a day, and then he went to being nearly helpless. Can you tell us what happened?
Well, it was such a sudden decline, according to his wife. I mean, he seemed fine, maybe a little bit different over the summer, and then she went away for a couple of weeks. And when she came back, he was a mess. It was hard for him to walk. It was almost impossible for him to eat. He tells the story of being at the Thanksgiving table and being unable to use his knife and fork. And so he actually ate his Thanksgiving dinner with all his family around with his hands. So he was in rough shape, and he wasn't thinking quite right. He wasn't moving quite right. In fact, when his wife came home, which was a couple of weeks before Thanksgiving, when his wife came home from her trip, the first thing she asked him was, "Have you had a stroke?" Because he seemed so incredibly different.
And of course, he probably didn't think he had a stroke.
Oh, no, he didn't think he had a stroke. And she took him, they went to doctors, of course. He hadn't had a stroke. That was made clear. But he did have some abnormalities. And nobody was quite sure. I mean, he seemed kind of Parkinsonian. That is to say, his joints were a little bit stiff, his movements were a little bit hesitant, his step was very hesitant, and he had a tremor. But it all came on way too fast for it to be Parkinson's. I mean, Parkinson's just doesn't do that. I mean, it's a much slower disease. And so it wasn't clear what was going on with him.
So they ruled out Parkinson because it happened much too quickly. What other sorts of things did they look for to try and figure out what it was?
They did a bunch of blood tests, of course.
Mm-hmm.
They were normal. They did a little bit more imaging, which was unrevealing. And basically they were like, I don't know, let's wait and see what happens. Time is often a very good test to see what develops. And so I think they were just waiting to see.
And then he fell.
And then he fell.
Which is often what happens to an older person, though 70 doesn't feel that much like an older person these days.
And it didn't to him either until then.
Well, what's so fascinating is here's a guy who was walking 10 to 15 miles a day and in great shape, and now all of a sudden he can barely walk, and he fell, and he ends up, I guess, in the hospital. And the neurologist was totally mystified, but a nurse kind of figured it out. Tell us about Nurse DeCenzio.
Well, actually, she was a nurse who was checking him in, that he had been discharged from the hospital. They couldn't figure anything out. He didn't need to be in the hospital, which is you sort of have to prove to be sick enough to be in the hospital, because hospitals are dangerous places. And so anybody who doesn't need to be there shouldn't be there. So he was sent to a short-term rehab facility. And the nurse who was checking him in did the usual stuff. She went over the medicines he took, and she was immediately struck by something that was unusual. He was taking Pepto-Bismol 4 times a day, every day. He was extremely fastidious about his medications and had been taking this for 8 months. Now, to be fair, the neurologist had also noticed this anomaly and had looked up bismuth or Pepto-Bismol overdose, and saw that usually what happens is you get too much of the salicylate component, the aspirin component,
right,
in Pepto-Bismol. And he didn't have any symptoms that looked like salicylate overdose. So she didn't do that. She put in, too much Pepto-Bismol, and immediately came across a case that sounded so much like him. It was a case of an older woman, I think she was in France, who had suddenly developed all these neurologic symptoms. And it turned out that she had been taking Pepto-Bismol pretty religiously for years, and suddenly had this acute change in her ability to move and think.
So it's almost like there's a tipping point then, that people could take Pepto-Bismol for a while and then suddenly it causes trouble, huh?
Yeah, and there are lots of people who take Pepto-Bismol for a long time, or there's some people who take Pepto-Bismol on a pretty regular basis and never develop any symptoms. And this woman had been taking it for years without developing any symptoms. But the toxic component is not the aspirin component, but the metal bismuth, which is the bismol in Pepto-Bismol. It's a metal, and it builds up in your body and can cause these terrible neurologic effects. So she suggested to the neurologist that maybe he should test the patient for bismuth toxicity, which he did. And his reading was, sky high. It was, 30 times the normal level of bismuth. Bismuth is all around us. It's a metal, so we're exposed to it in a lot of different ways. But his level was crazy. So the treatment for him, usually the treatment is just stop taking the Pepto-Bismol and you'll be fine. The patient was worried because his brain was affected. And so he wondered if there was something more they could do. And so they gave him a medicine that's called a chelating agent, and it sucks up the metal in your system and helps you eliminate it. And so he got a couple of doses of this chelating agent, and it seemed to help him get better faster. And so it took time. It wasn't overnight, but he's, fought his way back. And now he's not walking 10 or 15 miles a day, but he's walking 5 to 10 miles a day. And I think that sounds pretty good.
Agreed.
And his brain is back.
That's fantastic. What's the message, Dr. Sanders? We tend to take over-the-counter medications for granted, figuring they're completely safe. People don't read labels. What should we take away from this story?
Well, certainly nothing is completely safe. And anything that is completely safe, probably doesn't do anything at all. I mean, even water. You can have too much water. So, everything has to be thought about. Pepto-Bismol, and you can read it on the label, tells you that you shouldn't be taking it for more than a few days in a row. His doctor, I guess, erred by not telling him to stop it. I mean, he had sort of an ulcery, gastritis-y kind of pain and had gotten rid of it with the Pepto-Bismol. And so he thought, well, if it kept me from having this pain, why should I stop it? That's not the right way to look at it. Really, you think, okay, I don't have this pain anymore. I don't need to take medicine for it anymore. But his doctor is at fault for not being more explicit. I mean, doctors also think of over-the-counter medicines as not being dangerous. In fact, doctors are, I think, at fault for thinking medicines are not dangerous. But anything that has the ability to do good also has the ability to do bad. And we must never forget that, although we do.
Dr. Lisa Sanders, thank you very much for talking with us on the People's Pharmacy today.
Thanks for having me. It's great to be back.
You've been listening to Dr. Lisa Sanders, Medical Director of Yale's Long COVID Multidisciplinary Care Center. She writes frequently about diagnostic puzzles, both in her column for the New York Times Magazine and in her books. Every Patient Tells a Story, and Diagnosis, Solving the Most Baffling Medical Mysteries.
The idea that Pepto-Bismol could have gotten someone into such trouble is kind of hard to imagine until you read the label and see it's only supposed to be taken for 2 days at a time.
Our lines are open for your questions about the dangers of overdosing on over-the-counter medicines. 888-472-3366. Or you can send us email, radio@peoplespharmacy.com.
After the break, Dr. Ferrari will join us in answering your questions about familiar products like aspirin, Aleve, Prilosec OTC, or Zyrtec. Our lines are open. Give us a call, 888-472-3366. You can also email us, radio@peoplespharmacy.com. That number again, 888-472-3366. Share your story about over-the-counter medications.
You're listening to The People's Pharmacy with Joe and Terry Graedon.
This podcast is made possible in part by CocoVia, maker of the most proven and concentrated flavanol extract in the market today, Coco Pro Cocoa Extract.
With the proven power of cocoa flavanols, CocoVia supplements support blood flow from head to toe. This National Physical Fitness and Sports Month, give your heart and brain 100% and support a healthy you with the most proven flavanol bioactive.
Get 20% off your CocoVia order from May 6th through May 20th using the discount code FITNESS2024 at cocovia.com. That discount code again, FITNESS, FITNESS 2024, all uppercase, at cocovia.com.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Welcome back to the People's Pharmacy. I'm Terry Graedon.
And I'm Joe Graedon. The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. May is National Physical Fitness and Sports Month. Consider how CocoVia could be a part of your nutrition and exercise routine. More information at cocovia.com.
Today, we're watching out for possible hazards in the drugstore. Our guest, Dr. Stephanie Ferrari, is ready to answer your questions and help you avoid overdosing on OTC meds. She's the Henry L. Smith and James L. Olson, Ph.D., Distinguished Professor in Pharmacy Practice and Chair of the Division of Practice Advancement and Clinical Education at the UNC Eshelman School of Pharmacy.
Congratulations, Dr. Ferrari. This year again, the UNC Eshelman School of Pharmacy has been recognized as the #1 school of pharmacy in the country. What an extraordinary accomplishment. How did you folks do it?
It takes a team. It's a lot of work and a lot of teamwork, and it just takes all of us to be able to do the best work possible.
It's an amazing honor, and this is not the first year.
No, actually, it's been the third time that we've received the #1 ranking. So we are happy to serve the people of the state of North Carolina and continue to make sure that we are graduating future pharmacists from this school.
Well, we certainly need future pharmacists, so thank you for that. And our lines are open for your questions about the dangers of overdosing on OTC meds. 888-472-3366. You can email us, radio@peoplespharmacy.com. Do you have a story to share or a question about non-prescription products like Aleve, Allegra, Advil, Flonase, Zyrtec, Claritin, Prilosec, Tylenol, or any other OTC medication? You can ask that question, 888-472-3366.
Now, we just heard this amazing story about Pepto-Bismol overdosing. And I guess it's hard for people to think of something that's so familiar. It's been around 100 years, that it could cause harm. And yet this is a marvelous metaphor for a lot of medications that we buy over the counter, and we do buy a lot of them.
You know, this story, I'm very passionate about non-prescription drugs or over-the-counter medications because it is something that allows our patients to be accessible. You can receive the medication without talking to a doctor, without talking to a pharmacist. We can buy them at a gas station. However, we do need to remember that anything you put in or on your body could have potential harm. So reading the directions and reading the drug facts label is really, really important. I think sometimes what a lot of people don't realize, as a pharmacist, I want to try to get people off of their medications rather than on their medications because I want them to be healthy. And so I will make sure that when I do a medication review, I'm not just looking at prescription medicines, but I'm also looking at over-the-counter medicines as well as dietary supplements to make sure that they are safe and effective for those patients.
Well, let's talk to Matthew in Dallas, Texas, and see what his experience has been. Matthew, welcome to the People's Pharmacy.
Good morning. Hello. Hi.
Hi, Matthew. What's up?
So I just wanted to give a quick warning to your viewers. I had a few years ago, I had some nasal congestion. I took a generic version of aspirin, and I did not know that was only supposed to be taken for a few days. Had taken it for a few weeks to get over really bad cold, and I ended up being addicted to it for years. And
Whoa.
Wait,
Matthew, when you say addicted to it, a lot of people go, oh, Matthew was getting high on Afrin?
Oh, no. Let me clarify. I couldn't breathe. I should say I got a dependency to it. It got to the place where I couldn't even breathe through my nose without it.
And then what?
So it took, I was like this for years. I went to my doctor. I told him I can't breathe without this. He told me I developed basically this addiction or dependency to it. And he said, you just have to wean yourself off of it. It's going to be a very tough couple of weeks because you're not going to be able to breathe, but your body has to kind of remind itself how to do this on its own. And it was only this year I was finally able to kind of get off of it, so now I can breathe without it.
Well, Matthew, you are certainly not the only person who has had this very unpleasant experience. And part of it is, as you pointed out, you didn't realize that this medication should really only be taken for a few days. Just like Pepto-Bismol says on the label in tiny, tiny print, take it for a couple days. Dr. Ferrari.
So, Matthew, thank you for sharing that story. I think your story is a very common story of Afrin nasal spray. There's also eye drops, nasal sprays, that if you use them for more than 3 to 5 days, you're exactly right. It's something called rebound congestion, that actually the congestion that you were using the Afrin or the oxymetazoline, the active ingredient in those products to treat, and once you stop, you get worse congestion coming back, which sounds counterintuitive, but those eye drops as well as the nasal drops that have decongestants in them is usually 3 to 5 days. And that is a great point because on the label, it's really tiny font to read that, and not all labels say that. So I always encourage patients to quickly ask a doctor, quickly ask a pharmacist, just say, how long should I be using this for? And thank you for sharing your story because you're not the only one that has had that happen to them.
A lot of people don't read labels, A, and B, for a nasal decongestant like Afrin, it's very tempting to keep using it because now I can breathe. Oh, so wonderful. I don't want to go back to a stuffy nose. When you have been using something like this for not days, not weeks, not months, but years, how do you get off it? We've heard people say, well, my doctor prescribed a corticosteroids nasal spray like Flonase. That helped. I was able to wean one nostril at a time. Other people say, oh, I get saline and I dilute it down. What's your strategic recommendation for people who end up like Matthew?
Yeah, so great question. And so I think the best thing is to prevent it. And so 3 to 5 days, no more than 3 to 5 is taking it. However, if you are on it for years or months and have this rebound, I think, Joe, what you just said is what usually most people do. It's alternating nostrils. So using just the active ingredient, the Afrin, in one side, and then using either nothing or a steroid or nasal spray, which you can get over the counter or by prescription from your doctor, or saline in the other, and alternate is typically what people do. And hopefully that eventually gets them weaned off. I mean, that's where you need to really talk to a doctor or a pharmacist of how to wean.
If you would like to join the conversation, just give us a call, 888-472-3366. You can email us, radio@peoplespharmacy.com. That number again, if you had problems or if you have a success story with an over-the-counter drug, we'd love to hear from you. Again, 888-472-3366.
We go to Dallas in Raleigh, North Carolina. Dallas, welcome to the People's Pharmacy.
Hi, I just wanted to tell you a quick story about my grandmother. We kind of pieced all this together over a period of time. This has been maybe 25 years ago, I think, before there was a lot of awareness of some of this. And she always complained of stomach problems. Every time I'd go to her house, she'd talk about how her stomach felt. But she kept a bottle of Tylenol right there, and I think she probably took it for years and years and years daily. And, you know, when she developed cirrhosis of the liver, the doctors asked her how much she drank, and she got really upset because she had never drank a drop of alcohol in her life. But she actually died from cirrhosis, and we can't point to anything other than the acetaminophen. So I just want people to be aware of that. It's a serious thing.
Dallas, thanks so much for that call.
And we are so sorry to hear about that. I think a lot of people look on brands as something very familiar and very safe. And that's where, hospitals trust Tylenol. Shouldn't you? And so a lot of people think, well, acetaminophen, Tylenol, it's about the safest drug in the pharmacy. But people can get into trouble when they take it for long periods of time or take too much of it or combine it with alcohol. Now, that wasn't the case with Dallas's grandmother. But tell us a little bit about liver toxicity and acetaminophen, and what would happen if you ended up in an emergency department with an overdose?
Yeah, Dallas, I'm so sorry to hear about your grandmother. One thing I want to share about with acetaminophen is, before I get into your question, Joe, about what you do if you show up into emergency room if you have an overdose. Acetaminophen is the active ingredient in Tylenol. And one thing as a pharmacist, I always encourage patients to read the label or understand what is the active ingredient. We go based on brand names so often. And so you might hear Tylenol, Tylenol PM. You might hear other over-the-counter drugs. Aleve is another one. There's lots of things that contain acetaminophen in them.
Actually, Aleve, of course,
Aleve is a
non-steroidal anti-inflammatory drug that contains naproxen. But as you point out, acetaminophen is in everything.
It's in cough and cold products. It's in fever products. It's in pain relievers. And so many times if someone's taking acetaminophen for example, osteoarthritis, which would be typical, and then they get a cold, they might take a cold product that also contains acetaminophen in it, and they don't realize that both products have that same active ingredient. So really learning about that active ingredient is the first thing you can do to make sure that you are not taking too much, or see if you are taking the same thing. Typically, we don't want to take more than 3 grams or 4 grams per day. So that's 3,000 milligrams or 4,000 milligrams of acetaminophen per day. And it's a short period of time, usually less than a week, so 5 to 7 days. If you need it for longer than that, that's when we need to be under advice of a pharmacist or a physician to see the long-term effect of acetaminophen, because unfortunately it could lead to liver toxicity.
Well, in fact, we have an email from Doug in Rockport, Texas, who says, I can't seem to find anything on long-term use of Tylenol. I take 1,000 milligrams twice a day, at least 6 hours apart, for pain relief. And he wants to know, is that safe? So what you were saying in terms of the maximum dose, he's under that. But how long is it okay to keep on taking not the maximum dose, but still a pretty hefty dose?
Yeah. And so thank you for bringing that one up. So again, 3,000 to 4,000 milligrams, less than that is what we were aiming for. One thing I would, if I was talking to Doug in person, I would want to ask, what other medicines is he on? Is he taking any other medications that might have acetaminophen in them, to see if there's some hidden acetaminophen in it? The other things I would look at is what other medications is he on that are metabolized through the liver, because Tylenol or acetaminophen is one that's metabolized through the liver. All medications are either metabolized through the liver or eliminated either through the liver or the kidney. So those are only 2 choices in our body. So I would want to look at what other medications is he on, to look at what potential hazards or possibilities there might be to his liver. It's going to differ for every single patient, the answer to that question.
Well, before we leave Tylenol in the rearview mirror, let's talk to Rhonda in Fort Worth, Texas. Rhonda, you're on the People's Pharmacy. Tell us your story.
Yes, hello. Thanks for taking my call. And I am a truck driver, been driving for many years. And for the past couple of years, just ironically, y'all are talking about the question that I have. Because when I wake up in the morning, I'm so stiff, and just to get moving, I've been taking like a generic brand of Tylenol. And for about a couple of years now, I try to do it every other day, but sometimes I end up taking them like a week at a time, 1 tablet at a time, 500 milligrams. So I want to know what would be the long-term effect, and I try to drink about a half a gallon of water when I shut down at night. Is that helping at all?
Well, I suspect that a lot of people are like Rhonda, Dr. Frary. They just take it every day because they've got pain every day. Mm-hmm. And I'm wondering about something called NAC, N-acetylcysteine, just as a preventive of the possibility of liver toxicity if you're taking it daily.
But, Joe, you're asking a question to which there is no evidence-based answer. We don't have a study for that, do we?
We know NAC or N-acetylcysteine is the antidote when people have an overdose of acetaminophen.
Mm-hmm.
So if someone is admitted to the hospital and they find that it is acetaminophen overdose, or that, and again, it could be intentional, it could be unintentional.
Mm-hmm.
So many times it's unintentional. People don't realize that they're taking too much acetaminophen. That is the treatment that they use in the hospital to actually rid it from your liver to help get rid of the acetaminophen. Currently, over the counter for someone like Rhonda, I'm not sure that there's anything available that would help with that. Right now, it's only for treatment. I don't necessarily hear about it for prevention.
Well, exactly. We haven't heard about it. However, N-acetylcysteine, NAC, is sold as a dietary supplement.
Mm-hmm.
People take it for all kinds of reasons, and it's been promoted for this reason and that reason. Some of them even have some evidence to support them. I'm not remembering right now what it's good for, but it is good for some things. So it's certainly possible that somebody could take it. NAC. We just don't know what the effect is going to be, right?
Yeah, and I always get worried when we don't
Yeah,
know.
yeah.
So I always get worried of, why are we taking a medication to treat something else? Let's get to the heart of the problem, which might be the pain. So perhaps learning about some exercises. If it's the first thing in the morning when you wake up that you're stiff, what can we do to help our joints? What can we do to help alleviate some pain? Tylenol once in the morning is probably not too bad. What I would worry about is if it starts to need more, then the caution flag goes up, is what worries for me for Rhonda.
Okay.
So,
Thank
Rhonda,
you.
we're hoping that you'll be able to stretch out that stiffness in the morning. Good luck to you.
And thank you for your call, and good luck with that truck driving. We always love to hear from truck drivers. Thanks again, Rhonda. Bye-bye.
Thank you.
Well, we are going to be coming up on a break shortly, but I guess the one thing I want to emphasize, Dr. Ferreri, is that the FDA is supposed to be responsible that OTC drugs are safe. I mean, they say everything that they approve is safe and effective. And yet, I think that people may take that a little too far, because what we've learned is Pepto-Bismol overdose.
Mostly safe, mostly effective.
But too much. Same thing with Afrin. Same thing with acetaminophen. Some of these brands. I mean, we're going to talk a little bit later in the show about antihistamines, because people think they are completely safe. And yet we have had some fascinating stories from people that say when they stop taking a drug like Zyrtec or Zizal, they end up itching. So we'll find out sometimes just stopping a drug, even Prilosec.
Stopping Prilosec can be very difficult if you've been taking it for a long time. So, yeah.
We'd love to hear from you. If you've got a question or a story to share, give us a call, 888-472-3366. Our lines are full, so you could email us, radio@peoplespharmacy.com.
We are just about to take a short break. When we come back, we will talk about what you should look for on the label and what's missing.
888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graedon.
This podcast is brought to you in part by Urea Skin Relief from The People's Pharmacy. After years of work, we've gotten the formula just right. We're delighted to be offering this intensive skin therapy with 20% urea.
Urea Skin Relief Cream is not your average moisturizer. Formulated with a unique blend of urea and plant-based ingredients, it's specifically designed to deeply hydrate and soothe even the most stubborn dry skin. Whether you're battling the effects of harsh weather or you have sensitive skin that's prone to irritation, this cream works wonders.
Urea is a powerhouse ingredient. Not only does it act as a humectant, drawing moisture into the skin, it also beefs up the skin's barrier function. We're just as proud of what you won't find in our Urea Skin Relief Cream: no parabens or phthalates. Creating a cream for dry skin free of these common endocrine-disrupting preservatives and plasticizers was what motivated us to make this product.
We're offering a limited time discount for People's Pharmacy podcast listeners. You can get 20% off either the handy 2-ounce size or the hefty 6-ounce size of the People's Pharmacy Urea Skin Relief. You'll find them both in the body care section of the store at peoplespharmacy.com.
Make sure you put the code PP20 into the discount code box when you check out. That's capital P, PP20 for 20% off your Urea Skin Relief purchase through May 31, 2024 at peoplespharmacy.com. Welcome back to the People's Pharmacy. I'm Joe Graedon.
And I'm Terry Graedon. The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. May is National Physical Fitness and Sports Month. Consider how CocoVia could be a part of your nutrition and exercise routine. More information at cocovia.com.
Today, our topic is the hidden hazards of OTC medications. We're talking with Dr. Stephanie Ferrari, the Henry L. Smith, and James L. Olson, Distinguished Professor of Pharmacy Practice. She is chair of the Division of Practice Advancement and Clinical Education at the #1 School of Pharmacy in the United States, the UNC Eshelman School of Pharmacy.
And our lines are open for you at 888-472-3366, or you can send us email radio@peoplespharmacy.com. And we have an email from Jeff. He says, will you warn listeners about taking omeprazole? I was put on it by my doctor. I took it for years, and it was extremely difficult to wean myself off it. My heartburn was worse while quitting omeprazole than it had ever been originally, and now it's available OTC.
Well, that's such an important point, Dr. Ferrari, because a lot of these medications were once available only by prescription, doctor supervised. So I don't care whether it was Motrin or whether it was naproxen. Trying to remember the brand name. Naproxen, I think, as a prescription drug. And now you can buy Aleve and Advil and Motrin, and you can, be your own doctor when it comes to pain. But let's talk about the PPIs, the proton pump inhibitors, because Prilosec and Nexium have become household names. They are over-the-counter. Most people don't bother to read the label. So what's the deal on stopping PPIs?
I am so happy Jeff brought up this question because PPIs, gastrointestinal, so stomach in general, are a top seller for over-the-counter medicines. It's one of the top 4. And so many people go into the pharmacy and buy Tums, antacids, the proton pump inhibitors that we're talking about right now because they might have some indigestion or upset stomach or some heartburn. And to your point, these were all prescription medications, and then they got switched to become over-the-counter medicines. When they were switched to over-the-counter medicines, the directions or the indication is someone should have heartburn symptoms 2 or more times per week in order to be taking those. The other directions with these is they should not be taking them for more than 14 days. So the packaging is intentional, that there's only 14-day supply in the packaging. And so if you find that you need to be taking it more than 14 days and you have to go purchase another package, that's your red flag to say, stop. I need to go talk to a doctor, see if something else is going on, see if I need to get a different medication. And it could be that it's not heartburn. It could be something actually worse that you need to get diagnosed. And so that is a big concern because to Jeff's point, getting off of it is hard.
Well, you know what's so fascinating? If you read the label, it says very clearly, do not use for more than 14 days unless directed by your doctor. Repeat a 14-day course. If needed, you may repeat a 14-day course every 4 months. You have to wait 4 months before you can do it again. I wonder how many people read that.
Well, there's also some language on that label saying, don't use it if you have chest pain. And I mean, they're very careful. Trouble or pain swallowing food, heartburn with lightheadedness, sweating, or dizziness. And I think what they're trying to do is say, don't take this if you might be having a heart attack. Go to the ER. But they haven't quite said it that way.
So what are the long-term consequences of proton pump inhibitors? There have been some reports of pneumonia, for example.
GI infections are more common on people on chronic PPI.
So typically, again, when you think about taking a proton pump inhibitor, you're inhibiting the acid, which is causing the heartburn in your GI tract, your gastrointestinal tract. But however, some of that acid is good because it helps prevent bacteria from building up. And when you suppress the acid, you can get bacterial infections within your gut. You can also get it imbalances sort of your gut. You can get pneumonia. You can get other infections. So long-term effects of PPIs are, you would never think pneumonia. You might think, an infection in your gut. But I think that's the thing people don't always consider is long-term consequences of taking these proton pump inhibitors.
I've got an email from Bob in Alabama. Bob says, what about non-habit forming sleeping pills? I've been using them for quite a while, and I feel it affects my thinking in the morning, but they've been very helpful helping me get to sleep at night.
It might not just be the morning that he's having troubles with his thinking. Why, Dr. Ferrari?
What's in those sleeping pills?
It's very interesting he uses the term non-habit sleeping pills. I would be interested to know, Bob, what the active ingredient is in that non-habit sleeping pill. I'm going to guess I know what that ingredient is. So there's either one of two things. It's probably diphenhydramine is maybe one, or melatonin might be the other one. So melatonin's a dietary supplement, whereas diphenhydramine is a non-prescription over-the-counter medicine you find in Benadryl. You find it in Tylenol PM. You find diphenhydramine in many things. And so if that's what you mean by non-habit sleeping pill, diphenhydramine has lots of side effects especially as we get older. As we get older, it can cause foggy brain. So when you're saying that you're having difficulty with your memory, that doesn't surprise me. And it actually, if you take it at night, it can last 6 to 8, 12 hours, that sort of foggy brain, because that medication hangs out in your body a long time, and it takes a long time for it to get metabolized as you get older.
Well, it's what we call an anticholinergic drug.
I wasn't going to use the big word, but yes, that's what it is.
That's a fancy pharmacology
it's
term.
Fancy, and yet it refers to a neurotransmitter called acetylcholine. And so anti-acetylcholine, anticholinergic drugs have been associated with dementia when taken for long periods of time. And yet just about every PM pain reliever contains diphenhydramine. So thank you very much for that email, Bob. We appreciate it. Where do we go next, Terry?
We're going to talk to Ann in Kingstree, North Carolina. Ann, tell us what's on your mind.
Hello, Ann.
Oh, my goodness.
We've lost Ann. Shall we go to Endicott, New York, and talk to James?
More difficult.
Oh, okay.
So let's go to Barbara in Ravenswood, West Virginia.
Hi, Barbara. You're on the People's Pharmacy. What's on your mind, please?
Hi. Yes, I went to the eye doctor and was told that I have dry eyes. And the eye doctor told me to use Refresh Relieva PF 3 or 4 times a day. And I was wondering if that is safe for me to do that.
Dr. Ferrari, there are a couple different eye drops that are out there. There is the same thing for the eye that is used in the nose, what we call a vasoconstrictor. It gets the red out, but it too can cause rebound, redness, and congestion. But that's not what Barbara's talking about, is she?
I hope that's not what Barbara's talking
No.
about. So Barbara's dry. So the vasoconstrictor, to your point, is the same thing we talked about earlier with the Afrin. But with dry eyes, Refresh is a brand name that is wonderful. Sustain is another brand name I typically recommend. This is Barbara, where I would want to make sure you look at the active ingredient on those eye drops and see what it is. Usually it's polyethylene glycol, or it's PEG is like the short name on it. I'll be honest, as a pharmacist, I don't remember all the active ingredients, all the products, and that's where I read the labels and see what's on the labels. So with the Refresh, you want to make sure it's for dry eyes only, and that active ingredient is for dry eyes, and it does not have an antihistamine, and it doesn't have a decongestant in it. I'm pretty sure what he recommended sounds like it's appropriate for you, and for dry eyes, long-term use, that would be good to help with your probably itching that you're experiencing, and the dryness that you're experiencing with your dry eyes.
And that's what this particular medication is designed for, is consistent long-term use.
Mm-hmm. That is correct.
Okay.
Can we get James up from Endicott, New York?
We'll try.
Let's see. Good job, dear. Hi, James. You're on the People's Pharmacy.
Hi.
What's up?
My question is, for decades, I've been taking an adult aspirin for my heart once a day. Is this safe, or should I continue to do that, or should I lower the doses to a child dose?
James, it's a great question. You know, for years, Dr. Ferrari, doctors recommended an aspirin a day for people who might have a heart problem but hadn't been diagnosed with problems, so as sort of prophylactic. I think most physicians have done a 180-degree on that recommendation.
It seems like the aspirin recommendations keep changing every other year, so it's hard to keep up with whether we should be taking it or shouldn't be taking it. And I think, James, for you, it depends on, is it primary prevention? Is it secondary prevention? Have you had a heart attack? Have you had a stroke? There's more evidence, and their evidence is controversial regarding.
People shouldn't be doing this on their own without some medical supervision.
Definitely, that is correct.
There you go. So, James, our advice to you is talk with your doctor and follow his or her advice.
Now, speaking of aspirin and Tylenol, we have an email from Gail. She says, Joe and Terry, as part of recovery from hip replacement, I've been prescribed Tylenol, 1,000 milligrams every 8 hours, meloxicam, 7.5 milligrams daily, and aspirin, 81 milligrams twice a day as a blood clot preventive, all three for 1 month. I'm 74. I weigh 107 pounds. Although I'm grateful for the pain relief, I'm worried about my liver. Thoughts? Dr. Ferrari,
Thoughts for Gail.
I'm more worried about Gail's stomach from the meloxicam, but you know, she's got the meloxicam, she's got the aspirin, she's got the Tylenol, 3,000 milligrams a day, every day for a month. What do you think?
And it was short-term because of surgery, I think.
That's
is that
correct.
You said?
Yes,
Okay.
a hip replacement.
So for hip replacement, short-term for surgery, that's probably, again, month is the key here. Month is the key. And acetaminophen for 1 month for hip surgery is fine. The aspirin is typical because a blood clot is when you're worried after a surgery, so that does not worry me either. I think I'm most concerned about the meloxicam as well. But if it's short term for a month or even a week or 2 weeks, and see if you need it for the 2 weeks and see how things go. This is where using your physical therapy, working with your hip, and seeing how your pain is reacting, and talking at each of your physical therapy appointments of when can you start weaning yourself off of these medications. That's really the key question.
Well, that's good advice for Gail and anybody else in that situation. Let's talk to Elaine in Charlottesville, Virginia. Elaine.
Hello.
Hi, Elaine.
Hello.
Hi. I've been listening to you for so many years. My brother passed away a couple of years ago. He lived in the house here with me, and he had symptoms of sinuses, I guess for a year, and so he was doing all kinds of things taking a number of different OTCs, but in particular, he was using a neti pot, which I had never ever used before, although I've snorted salt water and found it quite effective. And so I guess to get to the end point here, Charlie would have these headaches and sinuses, and he would complain, whatever. One day I found him on the floor. He couldn't get up. I put him in the car, took him to Centara Medical Center to emergency. They took him in the room, gave him the CAT scan, and he had 9 brain abscesses.
Oh.
So I set upon for the next couple of years, because I was so upset, devastated, like what didn't I see with this guy, that he died of, and he got these horrible brain abscesses all over his brain. In addition to I didn't know it was a neurological problem when I took him there. And he had also had an endoscopy a couple of weeks prior to getting this way. So I started connecting the dots, and I thought, well, maybe he got an infection from the endoscopy procedure, and then it went into his blood and through the brain barrier. So that's the end of my story. That because we started with OTCs, he had tons of OTCs back here for his nose and his sinuses, because I found all of the medicines.
Yeah, we're just about out of time. Elaine, do you think the neti pot was responsible?
Oh, do I? Well, we don't know. I mean, I didn't have an autopsy,
but
okay.
The message says distilled water, right?
Yeah, he didn't use distilled water.
Tap water.
I don't remember.
Okay.
No, excuse me. He did use the water that he bought with the kit.
Okay. But I think that's one of the issues. Dr. Ferreri, you got to be thoughtful, because sometimes if you're not using absolutely pure water, it may cause problems.
And that has been shown to be a problem if you use just tap water with your neti pot. Yeah. Don't do that.
Now, we are almost out of time, and I promised I was going to talk about Zyrtec. I have an email from Yvonne. She says, I stopped taking a generic version of Zyrtec and have been itching like crazy. I thought I was reacting to an antibiotic I was taking. I've been taking Zyrtec for years. I had no idea there were side effects to stopping. I don't have any rash. I just itch like crazy. My hands, back of my neck, scalp itch worse. Today, day 4, and I hope the itching goes away soon.
But it's likely to last for a few more weeks.
It will take a while for the medication has to get out of your body, and that takes several weeks for it to get out of your body, usually 3 to 4 weeks. So hang in there, hang in there, hang in there.
And this is actually a reaction that the FDA wasn't paying attention to, the discontinuation problem with antihistamines. We
brought it to the FDA's attention, and they finally actually acknowledged that it can happen.
Well, that is all the time we have for today. So thank you for listening and sharing your stories. The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta and Ayasi Chinflu provided technical assistance. Al Wodarski engineered. Dave Graedon edits our interviews. The People's Pharmacy theme music by B.J. Liederman.
Thanks to our guest today, Dr. Stephanie Ferreri, the Henry L. Smith and James L. Olson Distinguished Professor in Pharmacy Practice. She is chair of the Division of Practice Advancement and Clinical Education at the UNC Eshelman School of Pharmacy, and the last time we'll mention it today, the #1 school of pharmacy in the U.S.
The People's Pharmacy is made possible by Cocovia Dietary Supplements. May is National Physical Fitness and Sports Month. How can Cocovia be a part of your nutrition and exercise routine? More information at cocovia.com.
Today's show is number 1385. You can find it online at peoplespharmacy.com. You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. And you can share your thoughts about this show. Email us your comments, radio@peoplespharmacy.com.
If you go to peoplespharmacy.com, you can sign up for our free, emphasize free online newsletter. This is an easy way to stay on top of the breaking health news. By prescribing to our newsletter, you'll also have regular access to our weekly podcast and find out ahead of time which topics we'll be covering. In Durham, North Carolina, I'm Joe Graedon.
And I'm Terry Graedon. Thank you so much for listening and for calling in. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.